You cannot bring us down by the Sea Boys. Beautiful piece of music there that has brought the time to 20 minutes past 1 here in the studio of Apex1radio. It's exactly 20 minutes past 6 in Bamenda, Cameroon. And from Bamenda, we shall be having Cynthia Wanchia with a health story that actually catches our attention. And so, some health centers and health personnel in Bamenda have today received awards for work done to improve the quality of life of women in terms of reducing mental or maternal mortality in Cameroon. So the awards is part of activities of a women's health project with focus on family planning and post-abortion care services, which are main killers of reducing or main killers in that country. So this project is an initiative welcomed by stakeholders of the health sector in Cameroon because maternal mortality is still very high in that country with causes that can be prevented if the women just know where to go and what to do. So our Northwest correspondent, Wanchia Cynthia, tells us more on the project and the award ceremony that took place in Bamenda this afternoon. And we're told that that event took place at the Bowen Baptist Center in Bamenda. So Cynthia now joins us on the show. Cynthia, welcome.
Thank you very much for having the program. It's actually some 24 minutes gone past the hour of 6 in the Bamenda, like the earlier indicated. It's the capital city of the Northwest region in Cameroon. And today, during the early hours of the morning or midday, we had this award ceremony. It was just a way of appreciating some health centers within the Northwest region, as well as some health personnel in regards to the quality of work that they have done to improve on the life of women or mothers within the Northwest. This, like you earlier on also indicated, it's a project of ACMS because we try to have that event live. Unfortunately, our times really couldn't be the same, but together I was able to put this report.
The awards ceremony to recognize best practices in reproductive health was organized by the Cameroon Association for Social Marketing, ACMS. The ceremony is the fruit of the organization's Women Health Project, which is in its third phase. The aim of this project is to reduce maternal mortality in Cameroon. The award, according to the organizer, encourages promoters, service providers, and community mobilizers to continue providing quality service, and it's a non-monetary motivational strategy. The award ceremony also celebrates the impact the Profarm social franchise network has had on the lives of the people of the Northwest region and Cameroon at large. Started in 2004, it was extended to Bamenda in 2011 thanks to the Women's Health Project, and 5 years later, the project, which seeks to improve the lives of women by providing quality reproductive health services, which include family planning and comprehensive post-abortion care, has recorded great successes so far. Because of this project, the health unit in partnership with ACMS continuously benefit medical equipment, relevant documents, and other medical consumables, materials, and supplies. The Profarm project has so far had a total of 31,961 IUD insertions and 3,559 Jadelin sessions alongside other short-term methods of family planning with the use of pills, injectables, condoms, amongst others. The gifts offered, according to Madame Fal Juliet, senior coordinator of the Women's Health Project, is just a show of appreciation to these healthcare centers, service providers, and family planning community mobilizers for the great job done in improving the lives of women.
The Profarm network, which is a social franchise network under the Cameroon Association of Social Marketing, has registered significant successes issues with respect to provision of long-active reversible contraceptive methods, especially IUDs, which initially were thought to be one of those methods rejected by women. Today, we can boast of, in a year, of providing over 10,000 IUDs to Cameroonian women in the Northwest region, Littoral region, and Central region. And we are proud of this success, and most of our users, they come back to us confident of what they are doing, proud of it, and we have satisfied users who are even ready to talk to their peers about these methods. Again, we have provided a good number of women with implants, which is equally a long-acting reversible contraceptive, but with a lifespan of 5 years. Unlike IUD, which have a lifespan of 10 years. And most women who initially didn't believe in contraceptive now are beginning to use contraceptive. And in addition to that, we are gradually dispersing the myths and disbelief with respect to use of long-active reversible contraceptives. Yesterday, most women thought IUDs could cause cancer, but today they know the difference between IUDs and cancers. And some of them are even more enthusiastic to use this method because they know in the course of doing so they will benefit from a cervical cancer test prior to insertion of an IUD, and therefore most of them will go for it, and they know that this method do not cause cancer but may promote the growth of a developing cancer already. So what we do, we make sure that we test them for cancer prior to insertion, and we have so many of them benefiting from these methods.
Amongst the winners, these two ladies explained how their work brought them to this level and how it has impacted their communities.
Well, my name is Vega Pamela. My colleagues call me Pamis Brown. I'm very happy for the award given to me today. It's because of my hard work. Yes, I use myself like a model in the community because I have taken IoT. So when I'm talking to you, like scared, and then I tell you I'm one of the people that have taken IoT. So, and then I'm always friendly. Well, because out there we meet positive and negative clients. So when talking to them, there are some positive and negative ones. When it is the positive one, you just talk briefly and you go. But when it's a negative case, you have to take her like your friend, introduce the method to her very well, tell her the advantages and disadvantages, then see with her, take her contact to get back to her if she is willing to take a method or not.
I'm Butu Pascaline Berry, a community mobilizer for BBH, and in this Women's Health Project, I've worked with this project since inception, and my role is to make this project impact felt in the communities. And I'm happy because when I talk to women, they're happy. They go and choose a method. At the end, they take a method that helps them to plan, space their children, and deliver the number of children that they want at the time that they desire to have them. I'm proud because since inception, I've been having prizes, which means what ACMS impact in me, the Women's Health Project is doing, is yielding fruit. I'm proud because right now in BBH, in Bamenda, where I had worked before, women, they now know the importance of family planning. You hardly see women having unwanted pregnancy or causing abortion because of this program. I'm proud to be a lucky winner of today, not a lucky winner. Hard work pays, and I encourage other community mobilizers to follow suit. Thank you.
The Bangolan Baptist Health Center, Bello Baptist Center, and Alpha Royal Clinic emerged first, second, and third respectively for best healthcare centers, while the Nkwen Baptist Center, Alpha Royal Clinic, and BBH took home prizes for best service providers at first, second, and third positions. This initiative of ACMS has been highly appreciated by the Ministry of Public Health because Cameroon still has a rate of maternal death which can be prevented. ACMS is an international non-governmental organization with a focus in health, and this Women's Health Project is just one of its projects which is being implemented in the center, littoral, and northwest regions of Cameroon. Its intervention covers the training of providers, equipping health centers, supply of contraceptive products through medical detainers, also medical consumables. The award ceremony takes place once a year as a way of motivating staff in improving quality of life for women. Wanchia Cynthia, Northwest correspondent for Apex1 Radio. Apex1.
Thank you so much, Cynthia. That was a huge one there. And we want to thank you so much for that very rich package from Bamenda in the northwest region of Cameroon. We're talking health, and we are happy when our people are healthy. Cynthia will be back next week for yet another package from Bamenda, Cameroon. This is Apex1 Radio. You're listening to Snapshots. Not Snapshots, but Fiesta, the 64th edition of the show, produced from Columbus, Ohio. Let's listen to some music, then we hit the road for our next stop.